My name is Raajen Patel. I'm EVP over Innovation at Sickbay. There's quite a few visibly detectable things that can happen if you're recording ECGs or other cardiac data continuously over hours and weeks. One example of this is junctional ectopic tachycardia. So we had a clinical researcher who was looking into a particular kind of arrhythmia, which can show up after surgery in pediatric patients with congenital heart disease. And the idea here is that as soon as you notice that this type of arrhythmia is happening, you change your care protocols to take care of the patient a little bit differently than you were before. So the earlier you catch episodes of this jet, and it can be a run of heartbeats, but they could last a couple of minutes and they can go back, right, to sinus rhythm. And so noticing that this is happening is really important. And if you're getting snapshots of this data, you don't necessarily catch if jet's happening, right? And this could cause delays, and this can cause delays in care, and then ultimately worse outcomes. But this is just one example, and it turns out that there's quite a few examples where people want to see effectively what happened before I came on the scene, or what happened before I came into the room, or what happened when I was out, right? What happened when the patient came and was in the ED, and then they went to the OR, and then they went to the recovery unit, and now they're in my ICU, that kind of thing. And if you're only getting snapshots from each place, you don't really get a sense of what happened and how things changed. You just get a sense of, every, so often. And so Sickbay being able to both record this data continuously and then deliver it in near real time helps you understand both what's happening now and what has happened, and can help catch these kinds of things like an arrhythmia when they happen, or arrhythmia a little bit earlier, and that can improve care. One thing that's really nice about Sickbay is that it's got unlimited users. So it's not just the cardiology team looking at it when the patient gets in. It's the folks in the ED can look at it when the patient's in the ED. Handoff becomes a lot easier then, because you're telling the story and you can show people directly links to Sickbay or views that are securely shared inside the walls of the hospital. So when the patient gets to that cardiology team, not only do they have a visualization of all of that physiologic history, but they also have the good stories from the folks who cared for that person before they came into that unit. That kind of collaborative care is, I think, really core to taking care of the patient in the best way possible, because then everybody's delivering their expertise in the way that they know how, everybody's sharing that expertise, and that patient is sent along a journey in which they are cared for at every step of the way.